Hello, everyone. Welcome back to our Focusing Pathways podcast. In this episode, Trey speaks with Dr. Tony Bates, renowned clinical psychologist and adjunct professor of psychology at the University College Dublin. Tony is deeply passionate about mindfulness and serves as patron of the Mindfulness Teachers Association of Ireland. He is also a celebrated author of several books, most notably Breaking the Heart Open, Shaping the Life of a Psychologist, and Coming Through Depression, A Mindful Path to Recovery. As you'll hear, Tony first discovered focusing in the early 1980s when he encountered Eugene Gendlin's much-loved book, Focusing. His interest deepened through the guidance of the remarkable Sister Mairead, and over time, focusing became a fundamental practice woven into the way he lives and foundational to his professional career and work in mental health. During their conversation, Tony reflects on his experience working with Dr. Aaron Beck, founder of Cognitive Behavioral Therapy, and on how Carl Rogers profoundly influenced them both. He also shares a powerful story from a mindfulness retreat with John Kabat-Zinn, describing how one simple statement shifted the course of his life. So now, we invite you to settle in and enjoy this rich and inspiring conversation.
Hi, Tony, and it's really lovely to have you here on our Focusing Pathways podcast.
It's lovely to be here, Therese. Thank you for having me.
So I know I reached out to you, I think it's probably a year and a half ago now, and I had read your book, Breaking the Heart Open. I have it here beside me. I had read it at Christmas, that Christmas, and something about the way you wrote in that about your experience with the body, I suppose, and with your feelings and with being with all of that and your childhood story. So much of that, I don't know, I really connected with. And I that's what moved me to reach, one of the reasons I reached out to you at that time, because I really thought, oh my goodness, this man knows about focusing, even though you didn't mention it at all in the book. But it was the language you used that to me was so familiar when I'm focusing and when I'm listening to anybody focusing. So I suppose that's what I want to ask you now about. Do you know focusing and how did you come to that?
I think it's interesting that I didn't mention it, and I imagine the reason for that is that it is so woven into the way I work that it's like I couldn't imagine working in any other way. I mean, it's one of these fundamental skills of my own mental health, as well as the work I do as a therapist. But it's like the term client-centered. Nobody uses that anymore because everybody is sort of client-centered, and that needed to be articulated and spelt out. But then it became part of just the way we do things as therapists. And so I think for me, focusing is just fundamental. And I came across it when I read Eugene Gendlin's book, and it was just magic, I thought. I mean, I can still remember my copy, which was really worn and paperback, that little brown cover, and it just was so helpful because up to then nobody had told us how to go about talking with people who were troubled. I mean, there was generally consensus that across all therapies that we should talk to each other and we should listen and encourage people to talk, to give their sorrow words. And that was always good. But of course, people didn't. We assumed they had access to what they needed to talk about, and mostly people, I don't think, have words for what they need to say, and they come into a therapeutic encounter with a vague sense of just being ill at ease in themselves, or frightened, or down, or just angry, or you know, demoralized by life, but they don't know what it is that's causing this or what they're feeling, and they don't have a way into it. I think focusing is a beautiful methodology in that it gives us a way into a person's experience, their deepest subjectivity. And it does it by starting with the body. And I remember Thich Nhat Hanh, when I was learning mindfulness, said all meditation begins with the body. And of course, now we're realizing all therapy needs to be at some point to go back to the body. It's where we hold our life memories and our wounds and our hearts, and it's the place we need to go. So focusing gave us a way to do that, and it showed us how we can help people find the language for what they need to say. And I do think that that is the highest cognitive skill that human beings can aspire to be able to reflect on my own experience and to put language on my own experience in a way that deepens my that experience. It more deeply connects me to it, and it allows me to express what's happening. And I mean that, whether we call it mentalization, that terrible word, or you know, our reflexive function, it's a capacity that I think is greatly undervalued. It's the single most important thing, that when we ask somebody how you are, that somebody can actually tell you and answer that question and say, well, I'm this, I'm that, I'm the other. Um, and when they can do it in a nuanced way, it's a superb skill. And as therapists, when somebody can do that and do it accurately, I think we're 50% of the way there. I can think of someone now I'm seeing she's only 23, but I've rarely met somebody who's so able to articulate her own inner experience, which is her boyfriend was killed tragically and all the rest of it. Very difficult, very painful, but she can do it with such nuance and focus. And all I need to do is to say, let's take a moment with that feeling. Tell me more about that feeling. Tell me what's that sigh? What's happening? And she'll stop, and she kind of does it herself now. And she'll just look, and she'll say, and then she'll come out with something which is never what I expect. I mean, it's always a
Mhm.
surprise. And she just says, and I think, oh my God, that's so on the money. It's just perfect. And I mean, it's just a pleasure. I don't feel I'm doing any work at all, actually, really.
Yeah. Yeah.
Um,
When I hear you say that, it's so interesting because it makes me think of the precision of the words that come when we're focusing,
yeah.
and how sometimes a word comes, and if somebody reflects it back, or if I'm focusing myself, I have that body sense of it's not quite that. That's not quite that word. So I may not know what the right word is yet, but I know somehow that that word that has just come doesn't quite capture what's here in my body. And then another word might come, and then my body knows that's right, that's the word. So that's amazing, isn't it?
It is extraordinary. I mean, mindfulness has, just taking it as a psychological tool for a moment, outside of its own history and its own ancestry. But someone like Mark Williams, who most people know, and has been such a tremendous leader in bringing mindfulness into psychotherapy over the last 3 decades. And but his most recent book, he's kind of I guess what terms of a kind of a deeper practice of mindfulness. And what he has done is introduce this Tibetan word, which translated means felt sense. So what he's doing in this now is mindfulness with focusing, although that poor old Gendlin gets no credit at all. But he's talking about what is the felt sense of this. So when I'm beginning to become mindful, what he's teaching us to do, and as I say, I think he's perhaps the most superb teacher of mindfulness-based cognitive therapy, and just generally, he's a great teacher. But he is moving into now the felt sense, and this is his new. And I was thinking, that's been there for a while.
Mm.
But maybe that's what we do in therapy. We rediscover these gems of insight and wisdom. I don't think Gendon had any idea. Well, I think he probably did actually, but he just how fundamental what he was sharing. It's like he hit on something which was so fundamental, and he did it really well, and that's what he gave the world and left the world with. And people saw it as just another technique rather than a foundational technique for any kind of self-awareness or other awareness. It's what brings us into where we need to be if we're dealing with pain of any kind, either in ourselves or somebody else. It just takes us to that place in a very elegant way,
Yeah.
at the client's pace and in their language.
Yes,
Mm.
because that's it, isn't it? That the focuser leads their own process and is in charge
Yeah.
of their own process. And that's so lovely to hear Mark Williams bringing the felt sense, Jennings' term in, isn't it?
Yeah.
And I suppose that's what Jen wanted, wasn't it? To see focusing brought into all these other spheres as well, to have it developed in other ways.
I think all great thought leaders are like that. I remember I worked with Aaron Beck, who developed cognitive behavior therapy, and I worked with him for a number of years. But I remember saying to him, what is your hope for cognitive therapy? And this was in the 90s. And he said, well, I hope it doesn't exist in 10 years, which is alarming for anybody now practicing and identifying themselves as a cognitive therapist. And indeed, I set up a master's in cognitive therapy, but he hoped it didn't exist. And I remember thinking, why would you say that? And he said, well, he said, my real hero is Carl Rogers, he said, and Carl Rogers developed this client-centered therapy, and we all did empathy and acceptance and congruence, and he said, nobody talks about those anymore. They're just absolutely taken for granted. And I said, so what would be your equivalent in CBT? And he said, and he was very quick to say it, but if you'd asked me to write down what he was going to say, these are not the things I would have written down necessarily, but they were really good. And he said, well, first is collaboration. He said, what's different is that specifically in inviting people to work as collaborators in this process. It's not me doing this to you or,
Mm.
and he felt that had to be a very genuine, honest kind of relationship, a very real relationship. And the second thing, though, which blew my mind when he said it, was that he said he was a Freudian analyst and practiced for 20 years, and he was a superb therapist and just beautiful to watch. I watched him with many people, and he said for him, Bion, the psychoanalyst, was a great inspiration, and he said, we have to find a way of being comfortable with not knowing, and that we need to enter in to this collaboration genuinely not knowing. Now, what Bion had said before was let go all memory and desire when you are starting to work with someone. And Beck said it differently, but the same thing, not knowing. He said, I called it guided discovery, but what it means is that you therapists ask questions from a position of genuine not knowing and curiosity. And so in that way, he was inviting or she was inviting the client to really think about their own experience, which was, if you like, another way of focusing. What is it you're feeling now? Whatever. And then the other thing was the third thing he said, which totally blew my mind, which was ironic because it had been my PhD focus for 5 years, which was homework. And he said, I think it's important that we don't ever imagine that insight alone is enough for someone to change. We need to empower them to do things that where they're making different choices in their own day-to-day life, not in the therapy. And that they monitor that and they have a sense that they can change and they are changing, and even in tiny tiny ways. And his genius was when he would assign, sometimes at the end of a class or end of seeing somebody, he'd say, okay, now what would be a homework assignment here? And all of us would generally either give too simple assignments or too complicated assignments. He just seemed to know the right thing to do, which would bring somebody on. But yeah, so I think again, it's I just feel that's one of these essential tasks that somebody needed to highlight, and Gendon did it beautifully, and it's I think it's been a great contribution, and as I say, whenever I talk about mental health, generally in a public lecture or so on, to me it is the most fundamental and also the most sublime skill that any of us can aspire to, is to be able to answer the question, how are you? And that I can say, because when I know where I'm at and what I'm feeling, I'm more able to bear it, I'm more able to work with it, and not to have any sense of knowing what I'm feeling is to be overwhelmed by my inner life. And that places me more often in a position of great vulnerability.
Mm.
I feel overwhelmed, you know?
Yeah, yeah. And I suppose that question, how are you, is we use it so superficially often in our daily lives, don't we? But when it's used in a focusing way, with the pause and, like as you say, the willingness to be surprised and really listen, it can bring something very new and fresh.
Well, I imagine a good focusing therapist would never, well, probably wouldn't ask the question, how are you? But they're more likely to say, let's take a moment
Mm.
for you to check in with how you are and
Mm.
help me. It, it it's 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 always a process, because how I am now is different to how I was this morning and or yesterday or actually ever before in my life. This is a whole new moment, and it's a new experience, a new constellation of subtle emotions and memories and everything. And it's different. It's different. And so if I'm to be with you, it helps a lot to be in touch with how I really am in this moment. And
Mm.
part of this moment is being with you. So I never had this before. So it's changed in so many ways. So what I don't want is a report. Well, generally for the last week I've been tired and a bit unhappy. Well, that's fine. We can record that and take note. But far more powerful is to be able to say, well, right now I don't want to be here. I just feel, what's the point? This is not working. I had a terrible week and I just felt nothing is changing and I'm really pissed off. And suddenly we're into the present moment and where the energy is, and life unfolds, between us. And
Yeah.
we, at that moment, it doesn't matter what's happening, it is going in the right direction because there's life, there's energy, and we can work with that always. And yeah, it's funny, isn't it? Um, so yeah, yeah, just focusing gives us a way to be with somebody that where I don't know the answers to that question for them, how they are, and to be really comfortable because I have the tools to engage with them from a position of being a learner, a listener, not being an expert who, oh,
Mm.
you're depressed, or the problem with you is you've got, oh, that kind of, and that's not atypical in the mental health field. I mean, there's a lot of experts who seem to have figured out exactly what people are doing wrong with their lives and exactly what they need to do to put them right. I've never figured that out, but I've got more and more comfortable not knowing, that,
Yeah.
and um, nothing frightens me. I go in to psychosis, to suicide, to rage, to, violence. I don't mind. It's great. I haven't a clue what's going on. I don't know what to do. How can I, but I know how to ask.
Yeah. And when
How-
I hear you, something about trusting, isn't it? Trusting
yeah,
the other person.
yeah.
Yeah.
I once, John Kabat-Zinn is another mindfulness teacher, and I'll just tell you a very short story. We were on retreat. It was a training. I did the mindfulness-based stress reduction with him, and there's a day in the training. It's a kind of an 8-day thing, and there's a day where you do a day of silence, and he gave this big preamble before the day. People just need to be silent, but it's okay if you find that too much, and you just need to come and talk. And I think, oh, God's sake, I mean. You know, what's so hard about being silent for one day, for heaven's sake? Come on, don't baby us. We can do this. And then this was the week ahead, the silent day. And the silent day came, we all went into it. And there was only one person in the group that had complete and total failure with silence, and it was me. I became, for whatever reason, very, very upset. And I mean, I was really upset, and I surprised myself intensely because it came out of nowhere. I, I had to go break silence and go to him, and he was at lunch. I remember he had two yogurts, and I thought that was very strange because these gurus they eat everything right. But he had two yogurts, so I thought I was surprised, again, just nonsense. But I remember saying to him, look, I need to talk to you. And he said, fine, no big deal. And we went outside the building, and it was summer, and there was sort of a grassy pitch, and we sat down, and I said to him, I'm not doing very well. I'm feeling really upset. And I just needed to say that to someone. And I remember he said to me a wonderful thing. He said, Tony, whatever you're feeling, there's a very good reason for it. And you and I are going to figure that out, you know. And he wasn't a therapist, but I've often said in public lectures repeatedly, if you had only one intervention, particularly with young people, it would be that, just to say that whatever you're feeling, there's a very good reason for what you're feeling. And our job is to figure that out.
Mm.
And if we can't, maybe somebody else can, we can talk to. But I think, it's interesting to use the word trust because for me, I deeply trust that. I believe that. And I believe if somebody's in the total grip of a florid psychosis, there is a very good reason they're feeling that way. And my job is to figure that out with them. And with them, not for them, but with them. And it may be that something has happened to spark, their deepest vulnerability, and they've gone over the top and they sound crazy, but you know what? Something happened here. Something happened.
Mm.
Um, and uh, or more likely, is people's acting out and their enragement is that something has been triggered, something, and it's just being willing to trust that I kind of refuse to see people as mad, even though most of us probably are. But I really believe in the core sanity of each person, that there's some part of them that is very sane and that is doing the very best they can in the circumstances they're dealing with their histories and their skills and their resources. And, what results is maybe the best they can do in this moment. And I want to understand that. And,
Yeah. Yeah.
and when we do, it always makes such sense. All the bizarreness disappears, and you just see the beauty and the sense and the logic of why people feel what they feel and do what they do. It's
Yeah.
yeah,
Yeah. And I suppose it's so respectful, isn't it, that way? It's so respectful of the intelligence of the body that
yeah.
something is wanting to make itself known and really welcoming that.
And that what's alarming for the person is that they're not able to connect with what that is, that something is, that they don't know why they're doing this and feeling this way. But again, through focusing or through just really quietly giving people time and through silence and through uh, enabling, allowing someone to listen within themselves, they begin to connect with things, and you often know this because they become very emotional, um, and and then you're in that territory where you can ask those powerful questions: what's happening, and what's it like, and what does it feel like, and what describe, you can begin to play with language. There is something about being able to translate experience into language. And there is something about us human beings. I don't think language is the only means of expression available to us. I think music and poetry and well, I won't use language, but movement. There's lots of ways that we can express how we feel. But maybe language gives us an ability to hold things in awareness and look at them. That I can sort of step outside in some way rather than be swamped or engulfed in this or immersed. And I can see what's happening. And and I believe that with that seeing, with that metacognition, with that, mentalize, comes naturally compassion.
Mm,
I think when I see it and understand it, I feel for that person feeling that, and it's not like I have to be compassionate. I think it comes as part of the package. It's so focusing when you're doing it right is a very compassionate method or intervention, without um and now I may initially, see what's happening and talk about it and then say, but that's really stupid. I should be over all that. That I dealt with that in therapy years ago. I thought I was no, that's okay. Then that's the cognitive stuff that, begins to make noise in my head. But when I get below the noise level of that, I think I connect, I focus, I connect, and then I think in my awareness, there's a kind of compassionate element almost always in my experience, in my
mm,
own experience, and in with people that when we understand, we can, or when we see what's happening, not we can bear it and be kinder to ourselves in that moment. It's powerful, you know.
yeah. 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 I mean, when I hear you, it makes me think of a couple of things. So, firstly, the that sense of, like we spoke about earlier, that kind of that bigger part of me that is able to be with whatever part of me is in pain or
Yeah,
in distress or afraid or whatever. And once I can access that, that that brings the compassion and the understanding and the acceptance. If I can just, yeah, be, and teaches me how to be with myself in that way. Really powerful. And also that when we're focusing with another person in a partnership, that my ability to listen in a focusing way to the other person enhances my ability to listen to myself in that way. Because
Yeah.
sometimes it's easier for me to listen to someone else with that compassion than listen to myself.
Yes. No, no, I think we learn all our, this is what my brother calls take my advice, I'm not using it. He's a GP, but he jokes about that. But I think we learn from others. It's funny, I was thinking there, I think so much of therapy is we get obsessed with or we get anxious about finding answers for the problems that we uncover, are the very painful emotions people are experiencing. And I think sometimes what we need is the confidence to hang out at the edges of these very painful moments with somebody and allow the experience to reveal its truth. All of these deep, painful moments are also there. Michael Harting calls them spaces of truth, but they have a truth in them. They have something to say to me and about my life. And when I can hear the truth in my suffering and what it's saying, I think that is healing. I think that's what heals. And but what I need is for you to hold me and to be with me in this space so that I can do that. Because all my life I've ran from any raw, intense emotion because I just didn't know what to do. So right now I'm going to run away again. I mean, and part of running away as well, I shouldn't be feeling that all that cognitive secondary nonsense that I get into is just a form of escape, or maybe it's fight or flight. I do one or the other. But when I can just be with it and just feel it and just let it be there, I think that's to me a really super skill in psychotherapy if you can enable that to happen. And I have experienced that with people, one of whom comes to mind, just a man I went to. He was a brother, a monk in Taizé, and he had my name, so I remember him, Brother Anthony. And he was giving a talk in Milltown, and I was going through, I think, looking back at kind of a nervous breakdown of some kind. But I was about 22, and I went up to him after his talk, and I said, I'm really struggling, in my life. I didn't know what question to ask him. And then he listened. He said nothing, and I went on. And the whole room was full of people. He spent at least 20 minutes. I can't really, it felt like hours, but with me in silence. And he was totally focused and completely unresponsive to all the other people in the room. And I was there, and he brought me closer and deeper into myself and back to myself. And it was powerful and it was phenomenally healing at the time. I remember walking away just feeling I had been seen and I had suddenly seen myself. And the problem is that my head was in the clouds. It was in a fog for most of the time. And this guy brought me back. He said nothing. Didn't give me one useful tip as to how to handle my nervous breakdown, but he was powerful. I think that was life-changing for me because it taught me a lot about the importance of silence,
Mm. And presence by his
presence.
human presence.
Presence, that's it. Presence. I'm here and it's a very funny story I'd have to tell about. I met Carl Rogers once, and he was speaking in the Marine Hotel in Dunleary in 1981, and it wasn't a very good talk. His wife had died, and he was coming over on a sort of a tour after this, a year or two later, and he'd been an enormous inspiration and read everything. And I was dying for this talk, as I'm sure everybody else was, but I just remember it was just okay. There was something missing. But in the question and answer, he told a story that just made the night precious for me. And the story was very briefly, his wife was dying and he was dealing with it very badly. And he talked about this. how difficult he found it. But she was at home and there was a nurse, and he left her one morning with the nurse and everything seemed fine. And he went into his office and he had his first client, and Mary was waiting there, waiting in the waiting room. And his secretary said, "No, Mary's waiting for you, you know." And he said, "Fine." Then the phone rang, and of course it wasn't a mobile phone. And he picked it up, and it was the nurse, and she said, "Now I don't want to worry you, Dr. Beck, but just or Rogers, I just let you know that she's gone. I just had her taken into hospital. The ambulance came because she had a sudden sort of, she seemed to fail very poorly, and I thought it wisest. And but she's okay, she's comfortable, she's fine. And you know, when you're done, just later you can go to see her at the hospital." He was very close to the hospital, his office. So he put the phone down and said, "Fine." And he went in and took Mary into the office, and he was talking to her. And after about 10, 15 minutes, he said, "I'm sorry, Mary. I have to stop this session." He said, I had a difficult phone call before we started, and I'm completely distracted by it." And then he said, Mary said to him, "Oh, thank God, doctor. I thought it was me." And I thought it was a wonderful story that, you know, people know when we're present and they know when we're not. And he was telling it against himself, but he was saying it. It was a powerful story. I never forgot that. Isn't that a good story?
It's amazing. Yeah. Yeah.
And so for that, the evening was very memorable. It was great
Yeah.
to meet him and shake hands and all that, but it was great
Yeah.
to.
Wow. And that was the part of the evening that stood out for you. That's
Yeah, yeah.
lovely. Yeah. Tony, when you came on that book, Jen book, what stage of your career were you at? And did that lead you to seek out a focusing course, or how did
Oh,
you
yes. No,
take
no.
yourself from there?
I mean, focusing was kind of, you know, it was a word that was spoken in shadows. You know, it was sort of a mysterious thing that had crept into the very small world of psychotherapy, because we're talking 1910. No, not quite, but we're talking certainly the 70s, 80s, you know, early 80s. So, I mean, there were very few, if any, formal training courses, maybe one, you know, and or two. And um, but really people didn't know, I didn't know what psychotherapy was. I was doing Gestalt at the time, and that's the course. We had some kind of training in that, and that was good. But again, I didn't know what Gestalt was, but I was doing it and then reading about it and making it up as I went along. And then I came across focusing. This was this word, you know, have you seen the focusing book, you know, and I came across it, and I just loved it. I think it was probably, I don't know when it came out. Do you remember the date it came out, that book? I'm thinking 79, 80, around then that I read it, which was very early. I only began in adult psychiatry in 77, and I had no training in psychotherapy of any kind. So this was all very new. In my world, we just made it up as we went along. We did little bits. I had Virginia Satir do family therapy. I had someone. We had all these luminaries, these famous people, you know, come over to Ireland on their way to England or whatever, and they'd stop by, and we'd all sign up for these courses, one day, half day, whatever we could get, and we patched together a sort of a quilt of insights about what to do with people who are messed up, you know. And there was all kinds of competing theories, and they were sometimes articulated in a very religious way. This is the way to do it, you know. And but really, we all were so poorly trained that we were open to everything, and sometimes I'm very glad of that. I had a very broad base of training. So by the time I encountered formal training in cognitive therapy, which was 81, I had been exposed to a whole range of things. And cognitive therapy was good for me because I was a very unstructured person, a very unstructured mind. I was wonderful at having lots of bits of things, but CBT gave me a structure to work within and a process. And for me, that was very important at that time. Not so, it changed over many years, but I still believe in that, and I think it is very helpful to be able to kind of, to pull together our insights into a kind of a working model of therapy. And that's how we did it. Focusing was, I met Sister Mairead, who was the teacher who was doing this thing. And again, the fact she was a nun made me highly suspicious that it could be of any value at all. But when I met her, all my suspicions evaporated. She was a powerful woman, and she just took me for an hour before we did anything and just brought me in touch with myself in a very dramatic way, a very powerful way. And then there was some courses that were running, and I did those, but I wouldn't claim to be a properly trained focusing person in the way they probably are now. I mean, I probably wouldn't qualify for membership of your network at all, you know. Um, but I I would qualify in terms of my deep gratitude to focusing, and to my how indebted I am as a practitioner to it over the years. Because whatever I learned was powerful and seminal to my work as a therapist. Yeah,
It's lovely to hear you mention Sister Mairead because, it's amazing the people who, learned that way back then in the
yeah.
80s, I suppose, from her and are still using it, that it's still so impactful in their lives, even if they're not calling it focusing or doing it formally.
Yeah, she was an early adopter. There's no doubt about it.
Yeah.
She got it, and she was wonderful. It's just a breath of fresh air. I think I met her in her seminary or wherever she was living. It was some sort of religious house, and in where in just not Dartry, but above near Cowper Road. It was just somewhere around there. It was somewhere elegant, and Rathgar, behind Rathgar, that kind of area. But I remember cycling over from James's. I was working in James's, yeah. So it was definitely, yeah. And I remember going to see her, and this was, yeah. But I would say that I don't know how many of your listeners are, just starting out. And I would say, looking back, I guess I've had 50 years now to look back almost. It's a long time. But the things that really have stayed with me and counted were not always the fantastic courses and the PhD in Oxford and all this kind of things. These were not seminal formative experiences as much as my meeting Mairead in that day on my bike somewhere in Rathgar, and there were other experiences. And at the time, we often count them as being kind of random and maybe not so important because they're not part of the real structured course we're doing, and never underestimate them. You don't know what will change you, and so being open and being attentive, because you may be surprised
Mm.
what you learn and where you learn it, and that
Yeah.
50 years later you'll be saying that was the thing.
Yeah, yeah, absolutely. And I know you've done so much to bring the mindfulness into our system, into our mental health system. And I'm wondering about the place of focusing and how you see what has it to offer and how you'd like to see it maybe grow or be used or come to people,
But
how to bring it to
and
people.
focusing is I mean, focusing on mindfulness are first cousins. I mean,
Mm.
there's no, and they're like my left and right hand. I don't think any of us in the mental health field can do anything without both of those skills. And one is being present, and the other is listening and enabling someone, not listening because I'm the professional and I need to listen to you to diagnose you, but I'm listening to you because with the intention of really allowing you listen to yourself. It's not important that I hear you, it's more important that you hear you. And so presence and listening with that in an empowering way, in a very, is they're to me just fundamental to all mental health services. And if we could get those across the board to everyone, every nurse, every doctor, every therapist, every psychologist, every social worker, they are fundamental. The problem in our mental health system is people are not heard and they're not seen, and they don't ever meet themselves in the process of treatment. And they leave after months of inpatient care with no greater sense of who they are or why they are the way they are than they had coming in. And I know this from people I've spoken to very recently who are, graduates of our private mental health hospital system. It's just not good enough, but it's accepted that the more important issue is that I know what's wrong with you and I frame it in my language, which is a sort of diagnostic language, and that I tell you what you need. That's honestly what every good upcoming psychiatric trainee believes they should be doing. And that's what they're told they should be doing. They're not bad people. They're just kind of operating within a very, very tight, narrow paradigm of care. And it's to me redundant. I think it's just not, it doesn't work. It doesn't let it go. It doesn't work. And but to let it go is to let go a great deal of power. That's the problem, because as long as we can medicalize what's happening, it's the doctor who's in charge, and he should
Yeah.
be in charge. So it is, it's power, and it's complicated. It's not just a lack of skill, but no, people need, if they could even just learn focusing and just that, if they could be told that it's okay not to know what somebody feels, and that most of the time we don't. And in fact, if we think we do, we're probably not the right person to be seeing that person. They're in trouble because we've them figured out before they even open their mouth. But if we are genuinely meeting people, we meet them with curiosity and we don't know how they're feeling. And if you give me a way as a trainee to be comfortable with that and give me tools to stay present with that, give me something to do with in terms of talking or inviting the patient or the person I'm seeing to explore these issues for themselves, then that would change everything. Would change everything. So I think yeah, it focusing should be mandatory for every body entering this mental health field. Everyone.
Are you hopeful about change coming?
It is coming very slowly. It's really interesting. It's coming from inside, not outside. It's coming from the top down. It's like people in psychiatry at the very highest levels are beginning to articulate their total disillusionment with the sort of DSM and the diagnostic system and the fact it doesn't hold up. It has no scientific base whatsoever. It's just and the evidence and science is showing that this doesn't add up anymore. So, um, we have no evidence that there are chemical imbalances in depression or that antidepressants change none of the, and the Royal College of Psychiatry had to come out and say this. And so suddenly, it seems to me we're beginning to let go a very narrow way of thinking about human suffering and begin to maybe accept that it's much more complex than we've known, and we need different tools to handle it. Um,
Mm. Yeah. Yeah.
so yeah, I'm hopeful about change, but I'm also aware that some That's my grandson is just playing um, football outside.
That's lovely.
I'm on a Zoom call, okay?
That's lovely. Yeah, I love what you say about the
Sure.
not knowing,
Yeah.
because
Mm.
that's the place, isn't it? That's the, if
Yeah.
we can be there and wait there, but there's always the
Also, with
rush.
that deep, the word you used was trust, and that I can still see the John Kabat-Zinn's face with me, looking at me and saying, whatever you're feeling, there's a very good reason for it. And I felt in that moment, I felt the man validated what I was feeling, but he made me feel sane.
Mm,
And it turned out my dad had died 3 weeks before, and I was completely disconnected from it. And I happened to mention it, and I remember he said, "Your dad died." Oh God, Tony, for heaven's sake! He said, "My dad died. I was a mess." And we did had this very man-to-man, not therapy conversation at all, but it was great. But I left him feeling fine,
mm,
and I only went because it was, in my mind, it was quite an emergency. I was really not coping. I didn't know what was going on, but there you go.
mm.
So yeah, so just trust people, trust them.
Yeah, yeah.
The people are never as crazy as they might sound or seem.
Mm.
Crazy is never as crazy as it might seem. Never.
Yeah, the body knows, doesn't it?
But
So before we finish, what's important for you now? How do you listen to yourself and be with yourself? How is mindfulness still a really important part of your daily life?
it is. It is. I mean, I suppose the answer to your question is, how do I do it? Well, I do it successfully and unsuccessfully, depending on the day. I mean, I I think the great myth of, psychology and psychotherapy is that, we're damaged human beings. We develop some bad thoughts or beliefs about ourselves, and we cope in very defensive and unhelpful ways, and we get into trouble, and then we finally see a therapist who explains it all comes out of this less than ideal childhood, or these kind of periods of neglect or abuse or trauma, and that this is why we're doing X, and this is, and then suddenly we all resolve. We sort ourselves out, and we continue to live a full and integrated mental health life. That's not what happens. That's not the truth. Not in my experience at all, personally, and never mind seeing it in people. And I've worked really hard in my own life on myself. I mean, I went into psychology because I needed psychology. I mean, I didn't see that at the time, but I did. And I learned an awful lot. I'd worked on my own therapy. I had a lot of different experiences that were very powerful and very important. But, I still have moments where I am taken by surprise by my own inner life, and some old wound behind the eye just bursts open, and I'm upset, and I find my whole system can kind of feel some primal wound that's very raw and hasn't gone away. And I think that's interesting because I know how hard I've worked to make all those things go away or to put them right, turn them into some kind of powerful, loving energy, But it, when I hurt, And recently I had an experience like that. It brought back out of the blue things I thought were buried long time ago, and I realized, we don't get over things. We don't erase anything. We learn to walk with them, and we learn to transform the energy of those hurtful experiences into something loving if we're lucky. into at least a kind of a deep empathy for others, that we don't, if we're honest with ourselves, I think we become less and less inclined to judge because we just see how hard it is to be human, and so for me, I think I'm happier now with myself than I've ever been in my life, and that's, if you knew my inner life, you would realize what a humongous achievement that is. It's worthy of a Nobel Prize itself. But I am genuinely happier with myself than I've ever been. And I have an extraordinary debt of gratitude to psychology and to what I've learned through that, but to all the relationships and the people who've been therapeutic with me. And, all of those things have been a big part of that, So I'm deeply in love with psychology and psychotherapy, but I'm far more, I think, uh, maybe more honest and more about the limits of those things, And mindfulness is really an invitation to leave the story that therapy crafts, or we craft in our minds about who we are, to let it go. That mindfulness is really saying to me now that that's not who you are, that you're not the story. That's descriptive language, and it's very interesting and helpful, and
Yeah.
your stuff is very real. You're not making this up, but that's not who you are. There's something more, and for me now, it's about letting go the story I've held, and just entering into the flow of being alive and doing very simple things, and but just feeling it and experiencing it more deeply than ever. And I'm happier, and I just feel less burdened. But that's where I'm at. As I say, I still get overtaken now and then, not too often, but um, recently I was very surprised by how active the old wounds still are. Um, and but I generally, yeah, mindfulness is getting beyond myself into the flow of my relationship with life, and that's where I want to live, and get away from me a little bit, or get out of me,
Mm.
into life, and I'm loving that bit.
Yeah, that's really beautiful, really beautiful. Thank you so much, Tony. It's been really lovely to chat. I really appreciate you taking the time to be here with us.
Thank you, Trace. You're a great listener. Thank you so much. You brought, yeah, no, it's great. I thank you. I enjoyed this very much.
Lovely. Thank you. Thank you.